The causes of hypertension or high blood pressure are well researched and involve a mix of genetic, lifestyle, and environmental factors. Evidence-based medicine identifies both primary or essential hypertension, which has no single identifiable cause, and secondary hypertension, which is due to specific underlying conditions. Hypertension can occur in young and older adults. I've had to manage patients in their 30s and 20s with hypertension. Primary hypertension accounts for about 90 to 95% of cases and is influenced by a combination of the following. Genetics. Family history is a significant risk factor. Studies show that certain genes may predispose individuals to high blood pressure, and this risk increases when combined with lifestyle factors. Aging blood vessels become less flexible with age, which can contribute to elevated blood pressure. Lifestyle factors play a significant role in the development of hypertension. High salt intake, for instance, is a major contributor. Diets high in sodium, especially from processed foods, are strongly linked to hypertension because they increase blood volume and arterial pressure. Obesity is another critical factor. Excess body weight, particularly around the abdomen, increases the workload on the heart, often resulting in higher blood pressure. Physical inactivity is also a concern. Sedentary lifestyles are associated with higher heart rates and lower cardiovascular health, leading to hypertension. Excessive alcohol consumption is a factor too. Regular heavy drinking can raise blood pressure over time and contribute to cardiovascular diseases. Lastly, stress plays a role. Chronic stress can cause temporary increases in blood pressure, and coping mechanisms such as eating poorly or smoking can worsen hypertension over time. Secondary hypertension occurs due to specific medical conditions or medications, accounting for about 5 to 10% of cases. Causes include kidney disease. Conditions like chronic kidney disease or narrowing of the kidney arteries, known as renal artery stenosis, directly affect blood pressure regulation. Endocrine disorders also contribute. Hormonal imbalances from conditions like Cushing's syndrome, hypothyroidism, or adrenal gland disorders can raise blood pressure. Sleep apnea, particularly obstructive sleep apnea, is another cause. This condition disrupts breathing during sleep and has been shown to increase blood pressure due to low oxygen levels and stress on the cardiovascular system. Certain medications can raise blood pressure as well. Non-steroidal anti-inflammatory drugs like ibuprofen, oral contraceptives, and some decongestants are examples. Lastly, illicit drugs like cocaine and amphetamines are also known to cause acute increases in blood pressure and hypertension with chronic use. Other contributing factors to hypertension include dietary deficiencies. Diets low in potassium, calcium, and magnesium can disrupt blood pressure balance. Insulin resistance and diabetes are also linked. Conditions that affect blood glucose and insulin, like type 2 diabetes, are associated with hypertension due to vascular damage and increased arterial stiffness. Environmental and socioeconomic factors play a role too. Access to healthcare, healthy food, and safe exercise environments all influence hypertension risk. Additionally, exposure to pollution and certain toxins can raise blood pressure over time. Prevention and management of hypertension are crucial. Evidence supports that lifestyle modifications, like reducing sodium intake, maintaining a healthy weight, staying active, and limiting alcohol, are highly effective in managing blood pressure. If you like salt in your food, think hypertension, and please try to reduce your salt intake. Early detection and treatment of underlying health conditions also play a critical role in preventing and controlling hypertension. Sources like the American Heart Association, World Health Organization, and Canadian Hypertension Education Program regularly update guidelines based on these findings to guide both prevention and management practices. In another video, we will discuss drugs used to treat hypertension. Subscribe to Dr. GT channel for more evidence-based medicine.